Imagine yourself sitting in an exam room, waiting on test results that you've taken. It's cold, you're alone. Suddenly, the soul-shattering silence is broken by a team of doctors. They walk in and have the results to your test. The prognosis is terminal. The doctors explain that there are no options. There is nothing they can do to save your life. Death is imminent. The illness alone brings you constant pain. Your body slowly wastes away to nothing. Pain medication that's given to help the pain, it manages the pain, but it brings on further complications of its own. You get to a point that you can't eat due to the nausea. You have to choose between living day by day in agonizing pain or staying drugged up on pain medication just to make it through a single day. Physician-assisted suicide is a humane alternative for terminal patients to leave this world with their dignity still intact, to leave their loved ones behind with the good thoughts of them and not watching them waste away to nothing. It's a way for them to go out of this world without the shame of wasting to nothing, without the suffering, without the pain, without wasting away. They're leaving their friends and their family, but in this way they're doing it with their dignity intact. They're doing it leaving their families with the good memories of them, not with the ones of them where they were incompetent, just a shell of who they used to be. Without the financial burdens that pain management costs them, without doctor's appointments daily, weekly, monthly, and tests that aren't going to save their life, they're not going to do anything. Following the news, the national news, as of January 2015, 4 states have legalized physician-assisted suicides. Oregon legalized physician-assisted suicide in 1997. They have multiple safeguard rules. A patient has to request from the physician this option several times. They have to go through many tests to ensure that their illness is terminal, that they're not going to be able to cure them, and they have to go through counseling to ensure that they are mentally capable of choosing this. Washington legalized in 2008, and they follow the same safeguards as Oregon. Vermont in 2012, and they follow the same safeguards. Montana legalized in 2009, in which they do not have the same safeguards. They're not actually sanctioned, but instead they allow physicians to use the request of their patients as a defense in a legal battle. These other states, as following the New York Times and other reputable newscasts, New Mexico in 2014, physician-assisted suicide was legalized in Bernalillo County for some specific cases. And it is actually under appeal to legalize it throughout the entire state. New York in 2015 and California in 2015 both filed with the Supreme Court to try and legalize it in their states. I believe that the rest of the nation should follow their lead. These patients, they go through agonizing pain from these illnesses. Every day that they live, their body is wasting away. Every move that they make, they are going through more pain than some of us can ever even imagine. And if they can just choose to end their lives without their bodies wasting away to nothing, deteriorating, it will save them so much heartache, so much depression. It would save their families. Think of your grandfather taking you fishing or taking you to the playground, carrying you on your shoulders. Think of you and him laughing, throwing popcorn at each other, watching movies. Think about those good times, and then think about him as a frail old man. He can't walk. He's too pained and too crippled by pain to walk. Breathing hurts him. He can't hardly talk. He can't go to the restroom. He can't do anything for himself. Think of him as an incompetent old man. Now, think about how you would feel remembering your grandfather as that, or your grandmother, or any of your loved ones. Would you want to remember them as that sick, frail person? Or would you want to remember them as the fun, the good times, the man you looked up to? Physician-assisted suicide gives families that opportunity to deal with a death in a more dignified manner. Hundreds and thousands of dollars would be saved on non-life-saving medications, non-life-saving medical treatments that they're just doing to try and keep these patients as comfortable as possible through their last days. Where if they were to just go on and choose physician-assisted suicide if that's what they wanted, these costs would be saved, would be spared, and so would their pain. Starks, Dudinsky, and White, in their article, Physicians Aid in Dying, says that suffering means more than pain. It involves a loss of independence, a loss of sense of self, and capacities that jeopardize their dignity. Allowing patients to suffer when death is already undeniable, it just seems cruel. Every patient holds a right to refuse treatment or discontinue treatment, as stated in the Patient's Bills of Rights. The Patient's Bill of Rights also states that a patient has a right to refuse life-sustaining treatment. That is respected by law through the Patient's Bill of Rights. The right to intensive palliative care and pain control is respected in the Hippocratic Oath that physicians sign upon receiving their board certificate. And why should the limits be set at that? Why should the limits not be raised to justify one's right to choose how they would like to die when death is already going to happen to them? We all know death is coming, but these people have been handed a life sentence. These people know that it's coming, and they know what is going to happen to them. They have the right to choose if they want to suffer with that illness or if they would like to stop where they're at and save some of their self, enjoy some of their last days, enjoy their time with their family, and go out of the world peacefully. I think that it should be legalized. According to many physicians, files through the Supreme Court, it's more than humane. It's more humane to allow this alternative to be legalized. Viller Adorno, in the 2013 article published in the New England Journal of Medicine, states that data proves implementation of physician-assisted suicide, when accompanied with safeguards, does not lead to uncontrolled and abuse in suicide. The safeguards involved with physician-assisted suicide in most of the legalized states include multiple requests from the patient. The patient must be seen by many physicians, different specialists, and have multiple opinions on the diagnosis and the prognosis of their illness. And they must undergo extensive therapy and extensive counseling to prove that they are competent enough to make this decision for themselves. National Center of Death with Dignity states what most of the safeguards are. National Center of Death with Dignity also states that the families of these patients should be on board with their decisions. They should support them. They should have time with these patients to say their goodbyes and to come to terms with the death of their loved one. Religion is a big aspect in legalizing physician-assisted suicide. Most religions deem this as immoral, absolutely not a choice. And people of those religions, that is their choice. You know, they can choose to opt out of this if it is legal. But people that are not religious, if this is what they want, they should also have that right to choose this. And also, it has been shown in statistics, from suicide statistics to physician-assisted suicide statistics, that a lot of religious patients, they come to a point where they can no longer deal with the agonizing pain that they are enduring every day. And they believe in the power of forgiveness. And so they come to a point where if this is what they choose, they hope and they pray that they will be forgiven. And that their higher power will approve of their decision and approve of them not suffering. And that's their right. It should be their right to choose that. Abortion is legal for a woman who decides that she doesn't feel that having a baby that she's pregnant with is right for her life. And if that is considered ethical or moral, why should a person that's going to die anyways not be allowed the right to choose how they die? According to national suicide statistics, legalizing physician-assisted suicide decreases the rate of gruesome, unexpected, out-of-the-blue suicides. These statistics show that patients with terminal illnesses sometimes have a really hard time coming to terms with that, and they might choose to go kill themselves in more unimaginable, gruesome, bloody, horrific ways. And their loved ones are the ones that have to come in to find them. And that's unethical. When they can make this choice and it can be done in a clean, dignified manner. I conclude that according to statistics, according to files through Supreme Court, according to cases that you can find anywhere, physician-assisted suicide should be a legalized option for terminally ill patients. The option to die with dignity should be a last resort to terminal patients. It should be a last resort, but it should come above if they choose a slow, agonizing death from an illness that's deteriorating their body. If they choose to end their lives before all of the pain and suffering, they should have that right. The safeguards should be followed, they should be placed, and they should be followed to a T. And the families should be included in the decision, and they should have a say, and they should have the time to say goodbye and come to terms with their death. But death with dignity is a better option than suffering. It's a better option than walking in and finding your loved one horrifically dead from them not feeling like they have another choice. It is an option to save patients and save family the pain and the heartache that comes with dealing with terminal illnesses, and a way to save financial burdens that's going to pass on to the families from medical bills that really didn't help them any. Physician-assisted suicide should be an option. It should be a patient's right to choose how they leave this world when they're facing a terminal illness.